When sexual function declines, that's scary, at least for men. On today's podcast, we're looking at the topic, The Flag Still Flies. Thanks for joining us for the Eat Plants, Feel Whole podcast, a program designed to help you harness the healing power of plants and transform your health. I'm your host, Todd Chobatar. I serve as publisher and editor-in-chief of Advent Health Press. And today we're talking to lifestyle medicine specialist, Dr. George Guthrie. Dr. Guthrie, welcome.
It's a pleasure to be here, Todd.
Today's topic is going to be an interesting one for us to discuss, sexual dysfunction. Can you tell me, how does that tie in to lifestyle medicine and some of the things that you deal with as a physician?
Well, it ends up that sexual dysfunction, sometimes called erectile dysfunction, where the man's sexual organs don't work as they used to, is related to chronic diseases. We've talked in past podcasts about the big four, that one of the problems that happens is blood vessels begin to get plugged up, and indeed other parts of the body have dysfunction. We actually consider erectile dysfunction, the inability for a male to have an erection, to be a red flag for heart disease. So it's very closely tied in with both heart disease, diabetes, hypertension, and whatnot.
Now, that's something I didn't know, that connection between erectile dysfunction and heart disease. So that may be something that's kind of an initial wake-up call, if you will, to
it absolutely can be. And to make it worse, many of the medications that are used to treat this kind of bad four, the metabolic syndrome, also tend to make to decrease sexual function.
So that's something that's playing a factor in this as well. So tell me a little bit about this, because to me this is fascinating. What is that connection between sexual dysfunction, particularly in men, and kind of the overall things that are going on in the body that could affect that?
Well, to really understand that, we need to talk a little bit about the physiology of the sexual experience.
Okay.
So it all starts in the brain. So the brain has an interest, and of course, men are wired with the testosterone. We tend to have a little more sexual drive than the women do. So when it's activated in the brain, there are nerves that then take the message down the spinal cord and end up at the blood vessels that feed the, for lack of a better word, balloons within the male penis.
Okay.
Now, these are, I suppose we could call, they're not exactly hollow because they have little fibers in them, but they're considered a balloon. Okay. So when
for an easy metaphor that I can understand.
Yeah, we'll try to call it that way.
Okay.
So when the blood vessel is then opened up, that allows the blood flow to go into these balloons, and it flows fast enough to pinch shut the exit. So when that's plugged up, of course, the balloons fill up completely, and there's the firmness necessary for sexual intercourse.
Okay.
So it's important for when you talk about the whole mechanism, for the mental part to be there, for the nerve part to be there, and for the vascular part to be there.
So all three playing a part.
All three need to work. For example, if a man's had a heart attack, he's often afraid that maybe he'd have a heart attack if he was having sex. So that fear might keep things from happening in the brain. If someone has diabetes, for example, they may have a neuropathy. So the nerves that take the message from the brain down to the penile arteries may be disrupted. So there's less of a message. The blood vessels may actually be plugged to the point where there's not enough blood that can come through, as in heart disease. And it's rather interesting. The size of the artery that goes to the penis is about the same size as the one that goes to the heart muscle. So if you're having a problem in one place, you're likely to have a problem in the other place.
Which is that overall body effect then?
All the blood vessels are affected, and including those. We consider erectile dysfunction as to be a red flag for heart disease. If your penis is not erecting as it should, then that may be a sign that you're also at risk for a heart attack.
So is this something in your experience that, I mean, I don't know, maybe it's stereotypical, but it seems like men are less likely to go off to the doctor to get checked out when, you know, some physical normalities, start happening. I don't want to go see a doctor. I'm fine. It'll all straighten itself out.
And so instead of going to the doctor, they wait for an emergency, and then they go to the ED, which emergency department and erectile dysfunction.
Okay. So that could be the emergency I'm looking for.
That could be the emergency, but it probably won't end up in the ED. It's probably the heart attack that does that.
But that's a key point, because whatever it takes for someone to sort of get that sense that, okay, something's not right in the body, I may need to go get checked out and see what kinds of changes I need to make in my life.
As it comes to me as a physician, usually someone is coming in for something else. The man will come in because he's got a sinus infection, or maybe it's a blood pressure check. And then just as I'm walking out the door, it's like, oh, by the way, doc, could I have one of those pills? Right? And then the story comes out kind of at the last minute that he's got some trouble with erectile function and would like some help with that. So that's often the context in which we see it. And, of course, it's important to help folks with that. We do have some medications which can help. Most of those, interestingly enough, work by amplifying the message of the nerve and making the blood vessel open a little more.
So the pills can work, but as a lifestyle medicine specialist, that's not necessarily your first choice, right? What do you...
We would probably call that the fastest choice, but the real solution to the problem is to get those blood vessels opened up. And really, since around 1990, when Dean Ornish first demonstrated to us that the arteries could be cleaned out, you could actually take the cholesterol out of the arteries, that it's been a possibility, anyhow, that the erectile dysfunction would also improve. Now, have you ever seen that film, Forks Over Knives?
I've heard about it. Tell me what's...
I really enjoyed it. They kind of have a fun way of dealing with this whole business of erectile dysfunction. There's a gentleman on the film who has heart problems, and we don't know about that early until later on in the film, and he's describing how he's now got more energy. And he also describes in... I think, a cute way, how the sexual function has returned and does well. And he puts it like this. He says, the flag still flies.
The flag still flies.
And, that put a smile on my face when I saw the big smile on his face. And I've certainly seen that happen in my own patients as well. People who make lifestyle changes to reverse heart disease, to manage that diabetes, to get underneath the basic metabolic problems of this metabolic syndrome, will find that their sexual function improves as well.
Which is fantastic, because what I hear you saying is that when we address some of the body's underlying issues with positive lifestyle choices, there are a number of things that are affected, sexual dysfunction being one of them.
Exactly. I mean, here's an example. We're learning a little bit about how these things may happen. Blood vessels dilate with something called nitric oxide. Okay? And that is made in the body from a little amino acid called arginine. It's got 3 of the little nitrogens sitting on the end, and the body breaks those out. Well, it ends up that plant proteins tend to have a lot more of the arginine than animal proteins do. So as one moves away from so many animal proteins and eats a lot more plant proteins, not saying that they're eliminated necessarily,
I understand.
But when you have a predominant plant-based protein, your body has more of the basic building blocks to open up the blood vessel.
So if I were to come to you as your patient and do one of these kind of things, I'm here to get my blood pressure checked, I'm here, my throat's a little bit sore, and just before you go out, I say, Dr. Guthrie, by the way, the flag's not flying so well. So give me a couple things, which of course you go into in depth in your book, but for someone who's listening today, what are some of the action items that you would have people go away with from this podcast here? Some things I can start doing immediately.
That is a huge kind of question that you've asked, and it really involves a full lifestyle change. That which is necessary to reverse heart disease will also reverse the artery disease in the penile artery and should bring the improved function. Now, of course, if you're coming into the office, I'm going to do a little more history taking. I've got to find out about the mind. How's it working? How are the relationships? Because that's an important part of life. If
Absolutely,
there's fear
sure.
and guilt and anger, that's not part of a loving relationship. I want to find out about a nerve problem. Certainly, we want to get diabetes under control. I would love to, since you came in with elevated blood pressure, I would like to have you lose a little weight, bring that blood pressure down, increase the potassium in your diet, lots of fruits and vegetables. And as you do that, I'm very likely to be able to remove that blood pressure medicine, which has a good chance of interfering with the function of that penile artery as well. So it's not a fast process. And I can pretty much guarantee you that once I've had the talk with you, on the way out, I'm also going to give you a prescription for that quick fix.
For the quick fix,
okay.
sure.
So you get the pill that tends to help, with an understanding that this is temporizing, and unless lifestyle changes, you're likely to have this progress to non-functional.
Yeah.
But you have an opportunity to turn it around.
And this is the chance to be able to do that.
This is the chance. The earlier you get it, the less challenge there is in reversing it. The less there has to be reversed if you change it early.
Now, you mentioned one resource, if you will, that you like this film, Forks Over Knives. One of the things that I like about your book, Dr. Guthrie, is in the back, and I'm just going to grab a copy right here and that I'm holding. You have a number of resources that you offer to people for free, and one of them is a list of your recommended resources. This is available in the back of your book, but it's also available as a free download if people come to the website eatplantsfeelwhole.com. Tell me about this list of recommended resources.
Well, I wrote Eat Plants, Feel Whole, not as a, how do one say this, a kind of the new person on the block in this whole concept. I'm not the new person on the block. I just have some people that I can influence. What I would like to do is to point those who are interested to resources from all around the kind of our larger community that can help people on the journey. It's not just one voice. There are many people working in this area, and I want to encourage our readers to move in that direction, to get connected, not just with me. I would like to be the starting point. So lifestyle can change, and certainly people can use the support that comes from so many of these other resources. So it's a pleasure to provide this, and I'm certain it's not complete, but at least it's a good place to start.
And these are ones that you've taken a look at. So you have some books that you recommend to folks, some cookbooks,
yes,
additionally, even some websites and some films.
Yes,
you have a list because people might connect in different ways
That's
with different
exactly
types
correct.
of resources that are there.
If I were to be asked which resource has most affected the patients, I would say it's probably that film Forks Over Knives. I highly recommend it as a way to hear a story and develop hope on the ability to change your lifestyle. I mean, if those people can do it, maybe I can do it. And as my patients learn that of course brings me great joy to see them improving their health on so many fronts.
And the neat thing is today, Dr. Guthrie, there are more resources about healthy lifestyle choices than ever. So certainly that film is one, but there are a number of films that you recommend, a number of websites and so forth where people can dive deeper. Those are free resources that folks can check out on websites. But then I like the books and the cookbooks as well, too, because they can be an important part, especially for someone like me, that likes to do a little bit of a deeper dive and to say, I really want to find out the best things that can help me to move forward in making those choices.
Especially on your journey to find healthier food choices. It's excellent.
It's a good choice. Good. Well, Dr. Guthrie, thank you so much for your time today. I appreciate it. You've been listening to the Eat Plants, Feel Whole podcast, a limited edition 15-part series where our goal is to help you to harness the healing power of plants and to transform your health. I've been your host, Todd Chobatar, and you can find out more about Dr. Guthrie and his work by visiting eatplantsfeelwhole.com. And if you'd like to discover other great resources that can help you to feel whole in mind, body, and spirit, then I encourage you to go to adventhealthpress.com. And while you're there, Please feel free to sign up for our newsletter, where you will find additional health tips, some leadership wisdom, and also many giveaways that we do as part of that newsletter. Thank you so much for joining us today.